Hey folks, so Dr. Wax here, and if you're getting this video, it means that you are trying to contact us to come in for consultation related to blood sugar abnormality or diabetes or insulin resistance. And I wanted to really take some time before you come into the office so you can get to know me, you can get to know about our program, and really get to know what to expect when you come in the office. But also I really wanted you to understand what's going on with your blood sugar problems and how we differ from everybody else that you've already been to. First of all, if you've gotten my information, you've probably been to our website, you've probably watched the testimonials on patients with incredible success stories in reversing their own diabetes. And yes, you heard me say that. They are actually reversing their diabetes. Our program is not like anything else that you've come in contact with. For most of you, you have already been to see many different types of doctors and specialists, and you're not getting better. You're getting more drugs prescribed to you over the course of time, not less. Your health is getting worse over the course of time, not better. And you're looking for an answer, really. That's why you reached out to us. That's why you said, yes, please send me some information and get me into the office, because you're really looking for a solution. So the first thing you need to understand is we are not going to be like anybody else. The first thing in terms of that, what I mean by that is, number one is we are not prescribing medications for your condition. Most of the patients that are coming in are already on multiple medications. And we already know that's not working. If it was working, why would you be moving from oral medication, one medication, to two to three, and then eventually insulin? And then why do they up your doses of insulin over the course of time? There has to be something else going on. So with what we do in our office in functional medicine, functional nutrition, is we're looking for every reason why the body is having either two things going on. Inflammation. There's something causing tremendous inflammation in your body, and the cell is becoming resistant to insulin, and it's not allowing the glucose to go into the cell. And it's usually both, there is some sort of autoimmune issue going on. But we're going to be looking at everything. You know, when you come in, it's literally about trying to figure out what is going on with your body. It could be some nutritional aspects that are not being paid attention to. It could be literally physiological deficiencies in minerals and nutrients. It could be gut dysfunction. It could be a whole host of things. And honestly, it's usually all of them that have gotten you to this place that over the course of many years. So the thing that I really need you to stress, or I need to stress to you, is I do not want you to wait until you have a major complication, because you know with diabetes you've got the neuropathies, you've got vascular problems, you've got patients that are having heart attacks, losing limbs, losing vision. There's so many different symptoms that come out of this. The problem is most of these go silent. Diabetes is one of those conditions that's silent for such a long period of time. And if you wait too long and the condition really starts to do a number on your physiology, sometimes we just can't help. And so I'm literally telling you this so that you are really ready to make that decision. This is what we do. This is a lifestyle program. And what I mean by a lifestyle program, it means you're going to have some involvement into this. You're going to have to be committed to changing things related to nutrition and related to some exercise. And no, it's not difficult. In fact, it's very easy, and most of our patients are so thankful. But there's a commitment. There's a commitment of time, and there's a commitment of energy on both of our parts. My team is so fully prepared and so organized and efficient and helping people get through this hurdle, but we can't be more committed to this than you are. So specifically for my diabetic people that I'm talking to right now, people that are having blood sugar dysregulations, you have to realize that everything you've done to date has led you to us, and it's failed to get you to where you need to be. It's failed to get you health. So in our practice, in our program, everything we do is going to be from a completely different perception. We're going to look at you from a different perspective. We're going to look at your whole body. You may come in with lots of pain, joint pain, back pain, neck pain, because that inflammation is everywhere. You may have sleep issues. You may have, as I said, the GI or stomach issues, gas, bloating, constipation, diarrhea, or you may have none of that. It's different for everybody. You need to understand that. So as you get prepared to come in here, there's a few things that you need to do. Number one is we need the most recent labs, and I'm going to request that you send labs that are 90 days or less, because we need to see those things. Now, if you don't have them, don't worry, we can get those handled, but you need that. I need to see anything that's been done to you over the last 6 to 12 months, but those labs have to be recent. I need you to fill out all the paperwork before you come into the office so that I can review everything prior to you showing up. So the time that you spend in here is a very valuable time with us. I need you to make sure that you watched all the videos that we send out, because that explains more about us and what we do, so that you're familiar with us. Because the time that you spend in here needs to be very valuable time about your problem. The last thing that I need you to know is that this office, this team, what we've done, what we've put together is so unique. We have a curriculum. This is the curriculum. It's a step-by-step ABC 1, 2, 3 process in reclaiming, or what we call revolutionizing, your health. Literally reversing this condition, but you're the one who's doing the work. We're doing it with you, we're coaching you, we're supporting you, we're helping you all the way through. But this is an education. This is a process. It's not going to be fixed in 1 visit or 2 visits. That's not how it works. And I think you know that by now. But the thing is, every one of our patients that are willing to commit to doing what's necessary, they get better. They get amazing results. They're losing weight. Their energy is coming back. Their family is saying, wow, I finally got my wife or my husband back, or my children have me back in their lives now. There's a lot of horror stories about diabetes and all the problems that come out of this. So I'm excited to see you in the office. I wanted you to know everything that we do and how we do it. So when you come into the office, you're going to go, hey, I'm familiar with all this. So get prepared for a great visit. Bring your spouse in, because I want them here to experience everything. It's very difficult to explain everything after the fact. So please bring them in for that first visit. It'll be a good education for them, and honestly, we need their support on this. So my team looks forward to seeing you. I look forward to seeing you. I also will let you know that I want to do a phone consultation with you before you come into the office, just to make sure we're the right fit for you and you're the right fit for us. So my staff will set that up for you if they haven't already, and I look forward to seeing you soon. Take care.